So hi folks, good morning, good afternoon, wherever you are. And today in dental practice management, I want to introduce my very good friend from Manipal, Dr. Anirban Bhattacharya. He's an excellent dentist in working in Calcutta. We were back together at Manipal, excellent tennis player, big Bryan Adams fan, can sing. Hopefully, if we get some time, we'll sing today, otherwise we won't. But today, Anirban is here more as his capacity as an expert in endodontics and conservative dentistry. He's been running his own practice in Calcutta. He's done his BDS from Manipal, MDS from Chennai. He's a key opinion leader for Coldine since 2011. He's also a consultant with the Apollo Clinics in Calcutta. Works as a professor in Haldia, and on top of it runs a very successful practice, very active in the Indian Dental Association, especially from the Calcutta office, has authored several papers. So one man, many facets. So Anirban, thank you for joining us today, and great to have you here as part of this series.
Thank you, Vikram. It's good to see you at the other end of the screen. It's wonderful to connect with you after so many years.
Correct. So Anirban, you've been practicing, and I can say you've run a very successful practice, right? Right now. What I want to understand is what are the three critical decisions you made that has led us to this situation where you are running a successful practice in Kolkata, being a KOL, etc. So what are those three critical decisions you made?
The first thing that I decided was not to try my hands with many other things. I knew that I know dentistry in general, but my forte was endodontics. So I stuck to the basics and I did only endodontics. So that's what I specialize in. And I'm happy to do only endodontics. I don't want to try my hands into too many things, I hate the fact to see people who just joined a course for just a day or two and they come back and call themselves implantologists, hang a board in front of the clinic and start practicing implants and, messing up big time. So I would say the first critical decision was to stick to what I know. That's very important. So I knew endodontics was my forte and I went ahead and I did endodontics the best way I could. Number two was being very honest in my profession. For example, if I land up with a fractured instrument into my practice, I would go tell my patient that, okay, fine, I've fractured an instrument. It's not a criminal offense to fracture an instrument, but in that way, it helps you in a big way to develop a kind of confidence with your patient. And number three is that each and every instrument that has been used into my practice over the years, all the way from 2003 onwards, has been ensured that it can go into my mouth as well at any point of time. If a patient comes and tells me that, like, doc, can you put the same instrument in your own mouth? I would be more than glad to do it because I would ensure that each and every instrument in my practice goes to the most stringent protocols of sterilization. So basically, these are the three things that I look into that would form the cornerstones of my practice.
Well, that's excellent. I really like the fact that you stuck to endodontics, though there's always this temptation to do everything else as well, or try to be many things to many people, but you became what you were, what you're core to, what you know and what you are. So that leads me to the next question is, see, Anirban, you seem to be doing a lot of things, right? And you have the experience and the expertise and the name right now. But how do you manage a dental practice, right? How do you run it efficiently so that at some stage our new and upcoming dentists can be like you? What do you do about your practice?
I don't know about that, but I'll tell you what are the fundamentals that I believe in my practice. Number one is to try and be punctual. You expect your patients to be punctual in your practice. And at the same time, you be punctual. It's very efficient. It's a very effective way of communication. If you pass on the message to the patient that you are very much punctual in your practice, the patient also will turn out to be punctual in the subsequent, time frames. That's number two. Number two that I have done is that I've digitalized. I've completely gone into digital mode of practice management. I carry my appointments on my phone, basically. So at any point of time, you know how traffic in Kolkata is. So if I get stuck on the way back from one clinic to another, if I get stuck, I would instantly give a call to the patient and say, hey, I'm just stuck up in a jam. I'll be there in another 10, 15 minutes. So that goes a long way in having a very healthy communication with your patient. The patient can never come back and tell you that you didn't communicate with me. And the third thing is that one more very important and a very efficient practice management tool would be to give a review call to the patient after, a day after you've done a procedure on the patient. That helps a big way for the patient to develop confidence in you. So three things would be: try and be punctual. Number two, try and digitalize your practice. And number three is a review call after 24 hours.
All right. Any, just taking us follow up on that, any digital tools that you will recommend in particular or in general?
See, anything, whatever way you're comfortable with, if you can digitalize the entire thing and just have a snapshot on your phone, that's also good. But I personally have been using Practo for quite some time. Been using Practo for the last probably 6 or 7 years. I'm very happy with it. It's extremely efficient tool.
Excellent, excellent. That really helps.